What is a DO and what's the difference between an MD and a DO? I'm Dr. Bryce. I'm an OBGYN resident and mom of 5 in West Virginia, and I am a DO. So let's get into it a little bit today. As always, please like, follow, share, save this video for future reference. Send it to your friends that are thinking about applying to medical school. And we'll talk a little bit today about the differences between an MD and a DO. So for all intents and purposes, from the patient perspective, you probably will never realize that you're seeing an MD versus a DO unless you see the initials at the letters behind their name. It is really not something that you notice. So one of the reasons why I was willing to go, or why I applied to both MD and DO schools, was because when I was working as a nurse, I had no idea who was an MD or a DO. There was no difference to me as far as their abilities, their knowledge, any of those things. In fact, when I sat there and thought back about it, most of my favorite doctors were DOs. So there really was no reason for me to not apply to DO school. Now, there are some things that you might want to consider when thinking about DO school versus medical school. The main difference between the training for an allopathic physician versus an osteopathic physician is that osteopathic physicians have to spend extra time in lab where we learn to do osteopathic manipulation or osteopathic manipulative medicine. That means that we learn hands-on treatments that can help enhance the regular medical treatments that we would be providing for our patients. For example, for me personally, one thing that I love to do for my pregnant patients who are having different aches and pains is show them some very gentle stretches and other techniques that they can do that I learned in my osteopathic lab that really helps alleviate some of their sciatica, their round ligament pain, their hip and joint pain. And these are great techniques that really provide a lot of pain relief for some of my patients. It's non-medicated. It's just a really great adjunct to all the things that that my MD colleagues provide as OBGYNs. So for me personally, that is just something nice and extra that I'm able to offer my patients. Maybe my MD colleagues could not. That being said, for all intents and purposes, for our patients, there's really no difference. We take the same boards, we're in the same training programs, we've taken all the same classes. Really, everything is the same. There's really no difference for you as a patient. The only difference comes is while you're in medical school, if you take those extra classes in osteopathic manipulative medicine. So what questions do you have about DOs, about MDs? I'm happy to answer any and all of those.